Tetanus is a serious bacterial infection caused by Clostridium tetani, a bacterium that produces a powerful toxin affecting the nervous system. This toxin leads to muscle stiffness, painful spasms, and difficulty breathing. Tetanus is sometimes called lockjaw because it often causes the jaw muscles to tighten, making it hard to open the mouth or swallow. Unlike most infections, tetanus does not spread from person to person. Instead, the bacteria enter the body through cuts, wounds, burns, or contaminated objects like rusty nails or dirty needles. Early symptoms of tetanus usually appear 3 to 21 days after exposure. Common signs include stiffness in the neck and jaw, muscle spasms, difficulty swallowing, and fever. As the infection progresses, severe muscle contractions can spread throughout the body, making movement painful and even causing fractures in extreme cases. In severe cases, tetanus can affect the respiratory muscles, making it difficult or impossible to breathe, which can be fatal if not treated quickly. Tetanus is diagnosed based on symptoms, since there is no specific test to confirm it. If a person has an open wound and symptoms of muscle stiffness or spasms, doctors will suspect tetanus and begin treatment immediately. There is no cure for tetanus, but early treatment can help manage symptoms and prevent complications. Treatment usually involves antitoxins, tetanus immune globulin, to neutralize the toxin, muscle relaxants to control spasms, and sometimes a ventilator to help with breathing. Antibiotics may also be used to stop the bacteria from producing more toxins. Severe cases may require intensive care and weeks of hospitalization. The best way to prevent tetanus is through vaccination. The tetanus vaccine is part of the DTaP or TAP shot, usually given in childhood with booster shots every 10 years. If someone gets a deep or dirty wound and hasn't had a booster in the last 5 years, they may need a tetanus shot immediately to prevent infection. Proper wound care, cleaning cuts thoroughly, and seeking medical attention for deep wounds can also reduce the risk. Without treatment, tetanus has a high fatality rate, especially in newborns and older adults. However, with early medical care and vaccination, it is almost entirely preventable. Tetanus is rare in countries with high vaccination rates, but in places where vaccines are not widely available, it remains a serious public health issue. Staying up to date on tetanus shots and practicing good wound care is the best way to stay protected.